the family has a doctor or primary care doctor in place, and you can recommend others if you feel that that's appropriate.
Yeah, so there's so many different things that are impacting someone's life. Different providers that they're working with, their home environment, their nutrition, their medical care, their emotional care.
Hi, everyone. Welcome back to another episode of the Elder Care Insights podcast by Welcome Back Home Care. So today we have a very special guest, Jaimee Friedlander, who's the owner of Guiding Care, Concierge Care, Geriatric Care Management Company. So welcome to the podcast, Jaimee.
Lee, thank you so much for having me. I appreciate it.
Thank you, and it's an honor to have you on the podcast. I know you're super busy, so thank you so much for finding the time to come and speak with us. Because the general public, everybody should know a little bit about geriatric care management and about what you do. So before we get into that, something we have in common, we both went to Terravella High School.
Yes.
So we're from the same place in Coral Springs, so that's something I learned today. And just tell us a little bit, how did you get into geriatric care management? What made you want to get into this field?
Sure. So I decided that I wanted to work with seniors. I fell in love working with seniors when I was in graduate school for my master's degree in social work. I had a very close relationship with my grandparents. I saw the challenges that my parents were having as a sandwich generation, dealing with different caregiving issues from afar. And I did an internship in graduate school at the FAU Memory Wellness Center, which is a memory disorder clinic. And I just fell in love with working with this population. And I worked at the clinic for several years after I graduated. And then I had the opportunity to get into care management. A position opened up at Jewish Family Services. And that's how I really got introduced to the care management field. And since then, I've been really just finding my niche and realizing that this is a space that has a great need in this community.
Yes, 100%. And so Jewish Family Services, great organization. So you got a lot of experience working at the Jewish Family Services, and then you spun off and you started your own organization.
Mm-hmm.
And
Yes.
the name of your organization?
Guiding Care.
Guiding Care.
Yes.
And we've worked together, so I understand intimately a little bit about your organization and some of the people that we work together with. So this is a concierge type of care management company. So tell us a little bit about what you do and what makes your company a little bit different than some others.
Sure. So care management is, it's a broad service. Everyone on my team is either a social worker or a nurse. We all have training in working with elderly or adults with disabilities, and understand that, it takes sometimes a village to take care of our loved ones. And so most of the clients that we work with, we help by assessing their situation, identifying what needs might be important for them to be able to have a healthy, independent life at home, or to avert any crises, or, to improve their quality of life. We help set up those services and then follow them on an ongoing basis. And a lot of the families that we work with, we really help with managing, overseeing care for complicated situations. So let's say you're an adult child and you're living out of town, let's say New York or California. Your mom or dad is down here in South Florida. They might have dementia, they might have cardiac issues, they might be in the hospital or in and out of the hospital, and it's really hard to get a handle on what's going on when you're so far away. Mm-hmm. And when you come down, navigating the healthcare system can feel very stressful and overwhelming, and oftentimes things don't always make sense. So, hiring a care manager can really help by coordinating services, being an advocate for your loved one, helping to give you peace of mind, knowing that there's someone local that's an expert that you can call on to set up and supervise the care. And we'll go in there and do a variety of services, whether it's referring to a home care company like Welcome Back Home and saying, we think that you could really use a caregiver in your home, and this is the schedule, and this is the type of person that you need. And that's how you and I have gotten to be colleagues and having a lot of mutual clients.
Yes.
Or we might say, we might need to get a new doctor, or maybe the medications need to be organized, or this is a safety issue.
Yeah.
What can we do to keep your loved one safe, healthy, and independent, and have the best quality of life.
So you and your company have many different resources to choose from. What many different, for instance, neurologists. I'm assuming, or different doctors that sometimes the family has a doctor or primary care doctor in place, and you can recommend others if you feel that that's appropriate.
Yeah, so there's so many different things that are impacting someone's life, different providers that they're working with, their home environment, their nutrition, their medical care, their emotional care. So we're kind of like the center of the wheel, and all these spokes are coming out that are the different aspects of the services that are needed. And we can be the person to kind of make sure everything's going smoothly and connecting all the dots.
Yeah. And so you mentioned a little bit about crisis. So do the clients sign up with you before the crisis, during the crisis, after the crisis? And so if someone has a crisis and goes into the hospital, will you be there with them or one of your care managers?
Yeah, so ideally, it'd be great for most families to be able to set up some support and services before there's a crisis, avert a crisis. But a lot of times we do get those calls when someone is in the midst of something. My family member's in the hospital, I don't know what to do. They're at home and they're refusing care and they need the help. So we can come in a crisis, help to make recommendations and come up with a plan, a short-term plan and once everything is more stable, come up with a long-term plan. But a lot of times we're fortunate enough to get involved with families early on, and we can come up with resources and services and plans for them so that they can avoid some of these crises that might happen. Like simple things like, have you met with an attorney and had your legal affairs put in order before a crisis? That can really be very important. Have you done Medicaid planning? Have you identified, who is, going to help you if you can't manage your financial affairs anymore? So
Wow.
we can do those advanced care planning, help them strategize. But if we're in the middle of a crisis, we can help them. We do go to the hospital. We do go to the home 24/7. If there's an issue, we're there.
Wow, that's terrific. So you mentioned a little bit about money management, crisis management. So let's touch on the money management a little bit. Seniors, they're getting older. Their faculties aren't the way they once were. Maybe they're declining a little bit. Maybe they forgot to pay their credit card bill last month. Like this can add up so much with interest, fees, and late penalties and payments. So go a little bit and talk about, so how do you manage the money, and what type of, do you set budgets for these folks, and how does that work?
Sure. Being able to manage your own bills is something that many of our clients find as an important part that they want to continue to be involved in. It's something that they identify as making them still feel independent. And so, but when someone starts to have cognitive changes, they become vulnerable to making mistakes or having being taken advantage of. So a lot of times we can go in and we'll say, look, well, why don't we plan when we come once a week, we can go through your mail, and over time we can help oversee and organize and simplify things for them and communicate to the family if we notice any red flags or issues coming up. The other thing too is we can help them access resources. They might be a veteran and not be aware that they're eligible for certain benefits. Or they might have a long-term care insurance policy and not know how to access it.
Yeah.
So, we can help them in terms of safely managing their affairs, and also pointing them to the right resources. If they want a bookkeeper, if they want an accountant, helping them get set up with trusted people that can assist them and keep their families involved.
Yeah, so folks, everybody out here listening and watching, just think about the value here with care management. How much does a plane ticket cost, right? How much does it cost for these late penalties and interest rates on this credit card bill? And what's the value of knowing that you have someone who's protecting your loved one, setting you up with great resources, making sure that they have a great caregiver, that their house is in order, that everything is nice and clean the way that they should be living. So I see so much value in care management and how you're overall protecting these people and helping the families. We spoke about how they start off being anxious, and maybe we're walking towards that step to peace of mind, knowing that someone has your back at all times.
Yeah, and a lot of times I find, older adults, they're afraid of telling their children or their close family members when they're struggling. They might not realize it, or they might be they don't want to burden their family, or they maybe are worried about losing control of their situation. And sometimes having a third party come in can help them feel like they're still involved, and that they have someone safe that they can talk to that can come up with solutions that isn't as close as a family member, where sometimes emotions run high and disagreements happen. So we can help to mediate a lot of challenges that come up and come up with solutions in a way that's comfortable for everybody.
Yeah, that's so great. And so about the services, do your clients have any sort of a long-term commitment? Is there a minimum amount of hours per month? How does that work?
Well, what I love about my company, Guiding Care, is we're flexible. So we might have someone that just wants a one-time consultation, pick my brain, get all the resources, fine. We might have some families where we're involved in every aspect of their care for an ongoing basis for years and years. And then there's all those families that fall in between. So I don't necessarily require families to sign up for a minimum amount of time. It's what's needed. And sometimes we work with a family intensely. They get through a rough patch and everything's stable, and then we don't need to be involved in as much. We might keep in touch by phone call periodically, and then if there's a new need that comes up, they know they can reach out to us. So it's a very flexible service.
That's great. That's great. So I'm sure you work with other agencies, not just Welcome Back Home Care. Tell us a little bit about the communication with your care managers and how they communicate. So we know that we communicate. Our coordinator, Claudia, who's fantastic, she has a direct line of communication with the care managers. So we work with Hope, we work with Gail, some of the care managers at Guiding Care, and it is a very direct line of communication. So how does Guiding Care communicate with home care agencies or nurse registries like Welcome Back?
Sure. So every family is going to be that works with Guiding Care is assigned to a primary care manager. And we work as a team, we cover each other, but you're really going to have one point of contact. You'll have that person's cell phone number, their email address, and that's the main person that be working with. And that's the main person that's also coordinating the services for that family. So let's say Gail, for example, is the care manager working with your family, then she's the one that's going to be the main contact coordinating the services. Now, some families prefer to still be involved in being the main contact and having the calls go directly to them, and that's fine. We're flexible. But if a family wants us to really be the quarterback of the team and setting everything up, then we'll be the ones on the call dealing with all the issues and making all the last minute, changes and say, look, so-and-so is needing X, Y, and Z, or they're happy with this, or, give some feedback, because a lot of clients have a hard time communicating with providers. They don't know, or they're not comfortable knowing what to say, or they may not know what information is needed. So when communicating with Welcome Back Home, for example, we can say we have this person and we know what information you need to be able to best match an appropriate caregiver.
Yeah, and we relay that information. Our coordinator relays that directly to the caregiver. We make sure she understands exactly what the family wants and needs. And so that's how we work. It's all about communication, and we have to listen about and for the needs of the families. It's all about the needs. So tell us what. This is kind of a curveball question, okay? So brace yourself. What was the best day ever from the time you started Guiding Care? The best day at Guiding Care?
Oh, that's a hard question. It's hard. Sometimes we work with families locally, but one of the gifts that we also get to do is help bring families closer together. So sometimes we'll be working with someone locally here, and they want to be able to move to be closer to their family in a different state or even in a different country. And we can help in those situations too. And sometimes, reuniting a family, helping to find, connect them to resources, help them, get all their care needs here settled, wrapped up, so that way we can travel with them, bring them to Connecticut or California or Italy or wherever, and, set them up in an appropriate setting so that they can be close with their family is really rewarding. And we've had the opportunity to do that a few times, and it's really nice when we can say, look, we can take care of your mom or dad here, but we can also help bring them to be closer to you.
That is so sweet.
And sometimes families just don't know how to do it. How do I get my 90-year-old father over here? where do I start? You know, so being able to say, look, these are the steps. This is what we can do. We can help you each step of the way is really rewarding. It's hard to say a particular day that's really the best.
That sounds great. So bringing the families together is something that you really connect with, and so doing these things that seem impossible for the families, you work the magic and make sure that you can accommodate that. You can basically do anything. Bring a family, for instance, to Italy or out of the country. They may need that. That could be a very difficult process, right? Mm-hmm. You need transportation. I'll give a shout out to Always On Time Transportation, and my brother Lloyd owns the business. And
they're fabulous. They've worked with a lot of our clients and accommodated some unique situations.
Yeah, Lloyd is terrific. I see how hard he works, so I am just amazed and very proud of my brother Lloyd because, you know, he helps so many families as well. You know, working with guiding care, and when they have to get to an appointment, it's super important that they get there, they're on time, and they get to that assessment or that visit with the doctor, and so we can continue this process and take steps forward. So connecting, getting folks to their appointments, getting them to the airport, it could require all sorts of things that, you know, I'm not, you know, there could be a medical jet company or something that you may work with, or, you know, someone that can accommodate folks in wheelchairs. So that's just amazing. That sounds like a great day and a great way to connect families together. So how many caregivers or how many care managers are on your team? You're a growing business. You're doing terrific. We're working together. We're both growing together. So tell us a little bit about your team.
Yeah, so I have right now there's 5 of us.
Wow.
It's myself, and then I have, and we all have our own unique strengths, you know. So I have Gail and Rhoda, who are both nurses.
Yeah. Gail Isaacs, amazing. Folks, like, reach out to Guiding Care and ask for Gail, ask for Jaimee, ask for Rhoda, ask for Hope. Like, they're all amazing. We've worked with them all, and very, very intuitive people. They're very resourceful, and the communication, they care as well. We're paired with people who care. Yeah.
Yeah. So I try and identify based on where someone lives and what their needs are, you know, who on my team is really going to be the best fit for that family.
Great.
And, you know, because we all have different personalities and we all have different backgrounds. And, you know, not everyone is the best fit for each family. So I try and really, like you match caregivers, I try and match care manager to be the best fit for that family and their needs based on their communication style and their, you know, but the thing that connects us all is we're all really devoted. We all love what we do, and we all treat our clients as if they're our own family.
Yes, I can attest to that 100% because we work directly, and I understand the devotion and how much we care, and we won't stop until the family is satisfied, happy with the services, and understands the real value. So that's so great, and so it's very nice to be working with you. And at Welcome Back Home Care, it's just been such a pleasure and an honor. So where do we reach you? How do we find you? You know, for the folks listening, do you have a website?
Yeah, so you can find me at www.guidingcarefl.com, guidingcarefl.com for Florida, FL. And then my number is 954-592-6032. 954-592-6032. And that number comes directly to me. And I like to be accessible to all of our families and make sure that everyone's getting their needs met. Yeah.
So, again, we're anticipating the needs. The best thing is to be proactive and to plan for the future. So go ahead and call Guiding Care. So before we go, let's talk a little bit about the discharge process. So we have a client who has been admitted to the hospital. Maybe there's a fall, and they need to take the next steps to progression, you know, to go ahead and get back home. Typically, what are the steps, and what do you tell families when someone enters the hospital and they've been admitted? What typically happens next?
Well, if we can meet the client at the hospital, that's really ideal. Oftentimes there's a lot of miscommunication even within the hospital. Medications, contact information, diagnoses, you know, everyone's busy at the hospital and multitasking, and it's very easy to overlook something or to mix something up. So us being there to advocate is really important. But mostly with the discharge planning, we want to make sure that there's a safe plan in place. and that families know their options. They might not be ready to go home, but they may not know that insurance will cover for a short-term rehab stay somewhere. Maybe they need mental health treatment, and we can help them to access these services. And if they want to go home, and making sure that home is safe. Do they have a caregiver if they need help with their activities of daily living? Can they take out their own garbage? Can they make their own meal? Can they shower themselves safely? Is the home safe? We can go in and make sure that the home is safe. Making sure that their medications are ordered and managed, their doctor's appointments are scheduled. A lot of times we go with clients to doctors because we can help them communicate what's been going on, and then communicate with all the other providers involved, because a lot of times that's a step that's missing. And Dr. A doesn't communicate to Dr. B, and they might be doing something that's contraindicative, and the families also aren't aware of what's going on. And the person that's there may have trouble hearing or remembering or seeing, and they're missing a lot of information.
Wow.
So going with the clients to those appointments, making sure all the recommendations are followed through, and putting together a plan. And knowing what the resources are. Maybe they need an adult day program. Maybe there's a senior center or transportation services that they have access, that they need access to.
Yeah. So also, like when someone goes into the hospital, they're not planning for this. This is an emergency. Something happens. Anything could. The oven could be left on. There could be. The laundry's still in the washing machine. It could be a mess all around the house, and they had the cleaning lady was planning to come the next day, but the house is a complete mess. So you can even.
We've had situations where we've set that up. Someone falls, and sometimes there might be a mess in the home, and we say, okay, let's make sure that's cleaned up before you get home. Let's make sure your mail's being collected and being checked.
Yeah.
If you have an animal, let's say who can, helping find emergency respite for your pet. Those are all things that are important to our families that we work with, and we make sure are addressed.
Yeah. And I'm sure sometimes you've worked with people who are hoarders, which is a very difficult situation. So that might take a little bit of time to reorganize, to make sure there's no emergency things to think about. And safety is always most important. It's paramount. So we want to also keep the caregivers safe and keep the clients safe. So sometimes we've had to call Stanley Steamer, and just get a real deep clean in there and create the better environment for the caregiver, for the client. So, wow. So for the folks listening, and if you've had your mother or your father or a loved one in the hospital, I'm sure that you would say right now, wow, I really wish I had Jaimee's information before, and so they could advocate for us. That's a key word, advocate, because the hospital discharge planners are super busy. The patient care advocates in the hospital are super busy. Doctors are super busy. But that's exactly what you do, is you're advocating for the clients in that time of need, in the emergency situation when mostly the children aren't here to do it. We love them like we're their kids, and so that's super important, and love to hear that, because this is what we need. We need more advocacy, and people like Jaimee and your team at Guiding Care. So please go to her website. We'll post it on the video. And so thank you, Jaimee. I think we touched on a lot of great things. It's an honor and pleasure to have you here on the Elder Care Insights podcast. And 100%. It's really great to be working with you. And we look forward to growing together. And all the folks out there, please give Jaimee a call and her company, Guiding Care. I'm Lee Berkowitz with Welcome Back Home Care. This is the Elder Care Insights podcast. And it was a pleasure having you.
Thank you so much.
Everybody have a great day. And thanks for listening, and thanks for viewing.